Hello, my name is Marty Swanbrow Becker. I am an associate professor at Florida State University, and my research focuses on suicide prevention. I'm here to talk to you briefly about how I engage in prevention in my field, how we can continue to help it grow, and what you might be able to do as someone who might be interested in getting more involved in prevention. For me, prevention started with clinical work I was doing, where I was working with people in an inpatient setting who had been admitted to the hospital for suicide attempts. And what I learned was it's so hard to intervene with people who are in a crisis like that. And it's much easier to work with people when they are in the earlier stages of distress. And I also found it frustrating that we would often help people stabilize from their crisis, but then we'd send them back into the very environment that had led to their distress. And I committed then to become part of an effort to learn more about suicide and suicide prevention so that we could help people avoid it in the first place, or at least minimize the risk of it, rather than waiting so often to treat them when they were in the crisis stage. So as part of that, I engage in prevention activities on my campus. I work a lot with our University Counseling Center and University Housing to deliver programming for students on our campus. While my focus lies in suicide prevention, I am also very interested in the sort of opposite, which is wellness promotion. When people are happy, when they're thriving, you reduce the risk of suicide then. So one way of thinking about prevention is thinking about what you want to prevent, and then also sort of thinking about the opposite of what you want to promote. My studies have looked at ways of understanding why some people think about suicide and some people maybe encountering similar stressors don't think about suicide, and what is it that might trigger us that way. And then coming up with interventions that would help people on campus intervene. One thing that we want to do is make it real easy for people to intervene, and often people find it difficult. There's lots of reasons someone might not want to intervene with someone else who's thinking about suicide. They might worry that they are invading someone's privacy. They might worry that they will give someone the idea of attempting suicide. And sometimes we worry that the person will say, yes, I'm thinking about suicide, and then we might not know what to do. And so my trainings have helped to help people overcome some of those fears, understand what they are, and think about it in a new way, and making suicide intervention much easier. In many ways, it starts with a very simple question of noticing someone who's in distress and just asking, how are you today? Or I notice you look a little bit off or a little bit different today. Can we talk about it? And that often opens the door. I think one way that we can continue to grow is help our clinicians take breaks from the intensive crisis work they're doing, especially on college campuses these days. So many students are presenting in crisis, and we, of course, have to have clinicians available to treat them. But that work is very hard and often distracts from work where we might get out into the field, onto campus, meet with students, and teach them skills that might help them avoid some of these crises. And as we bring the intensity of mental health issues down on campus, that would free up time to do more of that work. So we might get out and teach people about mindfulness meditation to help them relax, or time management skills. We might help people learn to manage their finances, or what to do when you're in a relationship breakup and how to sort of cope with that, how to find a career and find your identity. So I think for those of us who want to help it grow and keep it going, finding resources on campus that are working in this area, such as NAMI is a student group that you could help spread wellness across your campus. Could work with student government also to raise awareness and bring a focus towards the need for outreach and prevention to promote mental health. And another thing that you could do is find a faculty member who's working in the area of prevention and volunteer to be on their research team and learn how you can make a difference in bringing knowledge and expanding knowledge of mental health issues on campus and how we can intervene with them earlier, prevent the real deep crises, and help people really thrive with their mental health. Thank you for your time today. I hope some of this information was helpful, and I wish you the best of luck with your careers.